Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Smith. Your primary physician has referred you to me due to a potential issue with acid reflux or a related problem.
Yes, that's correct.
Okay. Can you provide some context for me?
It's been happening for a while now. I often experience heartburn after eating, which I've been managing with over-the-counter antacids. However, around 6 months ago, the issue became more severe, and I noticed other complications. Symptoms are somewhat inconsistent, but the predominant issue seems to be regurgitation.
I see.
And there's more to it than just that. Occasionally, I've been having trouble swallowing, but this doesn't happen regularly. Previously, I had experienced bouts of diarrhea, but now it's more like I have constipation. The inconsistency of these symptoms is driving me crazy. It's like walking on eggshells, not knowing what will happen next.
Did you have any other symptoms not directly related to your digestion?
Yes, I do have a recurring skin rash. It gets worse during episodes of acid reflux. Plus, I've noticed I get migraines around the same time as my digestive issues. It's a weird correlation, and initially I didn't think they were related.
Have you identified anything that exacerbates your symptoms?
I work as a software engineer, and my job is pretty stressful. Currently, the company is downsizing, and I'm unsure about my job security, which is causing me quite a bit of anxiety. I'm not sure if this has anything to do with my symptoms, but I thought I should mention it.
How does this condition impact your life most significantly?
Well, it's constantly on my mind unless I'm really focused on something else. It's exhausting, you know? I always feel drained and don't have the energy to do anything after work. I go to bed tired, but struggle to sleep due to my acid reflux. I wouldn't say I'm depressed, but dealing with this can get me down.
I see, and it appears you've been considering your diet as a possible factor. Can you share more about that?
I consulted a nutritionist who suggested that my acid reflux could be due to a lack of certain nutrients in my diet. But I eat quite healthily. I did try to increase my water intake and cut down on dairy, as the nutritionist suggested. However, I'm not sure if that's made much of a difference. I also minimized my caffeine intake, and I've had food allergy tests, but they didn't reveal anything significant.
Have you tried any medications?
Yes, I was prescribed a proton pump inhibitor by my GP to reduce stomach acid, but honestly, I'm not sure it's helping that much.
Have you tried any other medications?
Well, my doctor also gave me antidepressants. I'm not entirely sure why, though.
Antidepressants can help manage the communication between the nerves in your digestive system and calm down the muscles. Did you find this medication effective?
Yeah, it seemed to help a bit, I suppose.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mrs. Walker. It's nice to meet you.
Hello, doctor.
Let's start by talking about your current situation. Can you tell me in your own words about the issues you've been facing and how they began?
Of course. Call me Emily. It started 3 years ago when my wife and I moved into our new house. I was working as a warehouse supervisor, which involved heavy lifting.
I see.
I started feeling a sharp, persistent pain in my lower back. At first, I thought it was just fatigue, so I ignored it, but it got progressively worse. I sought help from a chiropractor thinking it might help.
Okay.
However, the adjustments the chiropractor made seemed to exacerbate the pain instead of alleviating it.
That's unfortunate.
Indeed. I then started using a heat belt, which gave me temporary relief.
I see, but it didn't completely solve the issue.
No. After a while, I started to experience a tugging sensation, almost like something was pulling my right leg upward.
Understood.
It was very uncomfortable and made it difficult to walk. A general practitioner I consulted suggested physical therapy, which I began right away. One day, the head physiotherapist looked at me and said, "You know what your problem is, don't you?" I was taken aback and said I didn't. He then diagnosed me with a condition called sciatica.
So what did you do next?
I was dumbfounded when he said there was no cure and I'd just have to manage it. I went home that day feeling hopeless.
I can understand your feelings.
He could have been a little more empathetic, I feel.
I'm truly sorry about your experience.
Thank you. After the diagnosis, I began researching what could be done to manage sciatica. I tried more chiropractic sessions, but they didn't help. I then started seeing neurologists and was put on a medication called gabapentin, but it didn't really help either.
Yes, that wouldn't always help with your condition.
That's what I realized. The best thing I did during this time was joining a support group for sciatica patients. It was comforting to know that I wasn't alone. I purchased a specialized chair to alleviate the pain, which did provide some relief. I read about a new treatment involving epidural steroid injections at a university hospital, which seemed promising. So I discussed it with my doctor, got a referral, and had my first injection in January.
How did that go?
Initially, the injections helped a lot with the pain, and I was able to walk more comfortably.
That's good to hear.
However, it gave me some side effects like nausea and dizziness. Just when I thought I'd found a solution, the pain returned, and I had to get another round of injections in June. The second round wasn't as effective. I ended up having 7 sessions and taking multiple oral medications, which I can't remember right now.
That's all right.
But nothing seemed to work long term. The side effects got worse, including memory issues. Eventually, they gave me a device for self-administered pain medication. Then I read about a newer surgical treatment in my support group's newsletter being performed by a local neurologist, which would be you. So, here I am.
We'll certainly do our best to assist you. I just need to ask a few more questions.